We now know that medical care determines less than 20% of our overall health. The majority of our health is determined by the social and economic environment where people live, work, learn, pray, and play. These factors include having an adequate income, good schools, safe and secure housing, effective transportation, access to affordable, nutritious foods, and a clean environment. These are known as the social determinants of health. We know that these determinants of health are significantly impacted by public policies. We now recognize that there are health impacts in almost every policy, what we label as health in all policies. Most people recognize that federal and state policies impact the social determinants, but less well known is the fact that what happens at the local level has a huge impact on the health of individuals and the health of our communities. Because of that, we're going to look at the role of county government in advancing the health of the public on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at the impact of local government, particularly county government, in advancing public health. We know that counties have a unique opportunity to affect the social determinants of health in their communities. It is also becoming evident that county commissioners have the ability to take a health in all policies approach that exceeds that of policymakers at many other levels of government. Joining me in this conversation is Toni Carter, a commissioner on the Ramsey County Board. Commissioner Carter has been the Ramsey County Board member since 2005 and has just completed her term as president of the Association of Minnesota Counties. She is the first African American ever to serve on a county board in Minnesota. Commissioner Carter, welcome to the program.
Thank you for inviting me. Really appreciate being here.
Yeah, well, later on, I'll share how I go around the state talking with a whole bunch of people and find that county commissioners are really some of the greatest advocates about public health. But I also recognize that, particularly in the metro area, a lot of people don't understand what counties do. Sort of in a thumbnail sketch, what kind of impact do county government have on the life of people in their community?
Well, I really appreciate the opportunity to be able to just shed some light on that, because you're right, particularly in the metro area, we mostly see the impact of cities when we look around, we look at our yards, we look at our streets and things of that sort. That work, in fact, is even done in collaboration with counties who are responsible for many of the roads and transportation projects within our areas, but we don't always know it. Counties cover a broad range of responsibilities, and it's all about our health. In Ramsey County, our role is enhancing our ability to live healthy, productive, and prosperous lives. And we do that in many, many ways. We do have a public health department, let me say, that engages with our community, both in health and social welfare, as well as in environmental aspects. We also are working to ensure that people are able to get to work through connecting employers with people who are seeking work. We work to make certain that we are able to support our justice system. The counties run the jails, for example, in our area, both for adults and detention centers for young people. We want to make sure that children are well, and that seniors are well, and that people with disabilities are able to live in an integrated fashion to the extent possible, and are able to be well as well. So that's our Community Human Services Department that does that work of supporting the most vulnerable in our community. We have a range of things that we do, Ed, and I could go on and on and on. We're responsible for records and taxes.
So you do economic development, you do streets, you do some transportation, you do some housing, you do some education, you do some public health. And corrections, a lot of people don't recognize that. How do you put a health lens on what you do in all of those areas? Obviously, people will certainly know, public health and social services, that's really about health. But how do you build in that health lens on some of the other things that you do?
It's really funny, but I do think that it is all about health. Having a community that is able to be physically well, that is able to interact well, Whether we're talking about public safety, which you have mentioned, or we're talking about community and economic development in terms of housing or in terms of making certain that people have jobs, all of this is about having a healthy community. It breaks down also to our public health department, which encourages people to do things that are healthy, to eat well, to exercise well, to avoid exposure to, for example, chemical issues or tobacco, to make certain that people are aware of the things that are healthy in their lives. So we think about those things, but then also, what about helping people to be secure, to be economically secure? The impacts of all of that on our health, of our safety, of where we live. We know today that your zip code can, in fact, determine your health, of how we work and play together. All of these things have impacts on our health. And today, as you said to start, we know so much more that although it's important to have a strong clinical environment and access to health insurance and to get to the doctor, it is also important to be connected to community, to be working and have an income that can support your family, to be educated, because you'll look and understand that education and the levels of education also determine health. All of those are factors where the county can, through the work that we do, support health, safety, environmental protection, things that help us to be healthy and well in our lives.
So when you're setting the policies for all of these things, and do you put sort of health indicators as some of the evaluation tools? Obviously, you say, what's the cost of this project? How efficient is it going to be? Is it going to deliver the number of services to a number of people? Do you put health indicators in some of those things that are out of the traditional health realm?
Yes, and I think we've done so more informally in the past. Today, as we understand so much more about the social determinants of health, and as we look at our community, especially in a county like Ramsey, where such a large percentage of our population lives in poverty. For example, in St. Paul, 36% of the children in St. Paul live in poverty, compared to 15% statewide. We have to examine everything that we do through the lens of how do we help people be more economically secure? How do we, in fact, help to overcome the issues that poverty brings into our lives? And how do we support the strength and endurance, the resilience of people who are overcoming issues every day in their lives? So we have a new economic prosperity initiative that looks at every area of our work through how can we determine and motivate economic security for our community. These are ways in which we're beginning to look across our entire county's work. Our budget hearings coming up, in fact, we'll have our department managers sharing with us what role they play in encouraging economic security and in supporting the determination and resilience of people in our communities.
Well, it sounds like you do take a health in all policies approach.
I think that's probably a term that we got from somebody.
Well, we're using it as often as we can. Well, I know in the second part of the program, we're going to be talking about one of the specific programs that you have related to some of the issues that are really unique in Ramsey County. But first, we need to take a little break. We'll be back right after this message.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome back. We're discussing the role of county government in addressing public health issues. One of the ways that they do this is through the development of innovative programs to address local needs. In this segment of the program, we're going to look at one of those programs. It's called Club Mom. Club Mom is a new group model of health education for African American women who share the goals of reducing health disparities among African American women and improving birth outcomes for African American children. Club Mom has emerged as a viable alternative, or in some cases a complement to home visiting services. Joining me and Commissioner Carter to talk about Club Mom is Tamiko Ralston, a public health nurse in Ramsey County. Tamiko, welcome to the program.
Thank you for the invitation.
Yes, and I know Club Mom is sort of a new innovation in health and developing health, and particularly among people of color and American Indians and low-income populations in cities and counties. Tell me a little bit about Club Mom, how it got started and why it got started.
So we looked at, our Ramsey County Public Health Department looked at how can we complement the work that we're doing with our families. We've been doing the home visiting model, and so we looked at what are they doing in other areas of part of our nation. And so we looked at Alameda County, California, which is where Club Mom began with their Healthy Start program. And we looked at how can we implement this to fit the needs of our community, and that's where it evolved from.
Mm-hmm. So what were the needs that you saw that weren't being appropriately or adequately addressed, not appropriately, adequately addressed in Ramsey County that said, you know, we really need to do something in addition to what we're already doing?
Well, I think we do a great job in our public health nursing and our home visiting programs. However, a lot of times with our African American community, we do things in a group. And it's like, come and go with me, come and do this with me. And with that, the group model was really effective way of doing the community service and to our families.
So I know public health nursing does a lot of home visiting, and that's been shown to be really effective. So is this sort of a complement to that, or is this instead of that, or how does this work with home visiting?
It is. It's a complement to our home visiting. Some of our home visiting nurses have been giving us referrals from their caseload, some that may be coming out of their caseload and going into wanting additional services and having additional needs. Social isolation is one of the reasons that sometimes the nurses may say, well, we want additional services for our families. However, we also have families from all different walks of life. So families who are working, families who are more so older women. Yeah.
Commissioner Carter, how does this fit in with your overall view of how the county should be interfacing, particularly with young women in around healthy birth and healthy childbearing?
Well, thank you, Ed. We know the impact that parenting has on the ability for young children to grow and develop well through their lives. And these young mothers and dads as well, who benefit from our public health programming, gather together and really form a culture of healthy support and development for their young people, for their young children. And this, of course, is what we want if we're going to build a prosperous and healthy community. So I very, very much support and am glad for the traditional culture that we have in our public health department of collaborating and working with communities and community organization, and now also of building and strengthening the capacity of young people together to create a healthy community. I think this is going to look like young parents growing together and young children growing healthy.
Tamiko, how does the program work? What do you do in the Club Mom?
Okay, so moms come in, and they have dinner. So we're encouraging positive parent-child interaction. We have an hour where moms get to know each other, and they do some icebreakers, and the moms and the children have dinner together in a community setting. And then the moms send the children. We have our public health nurses, and we have interns that help with the child care piece. And they go into the child care for that next hour, so moms can tune in to the speaker. And our speakers come with various topics related to the contributing factors of infant mortality that we have learned from MDH and we've learned from CDC. And we have them have an opportunity to engage with feedback and have question and answer. And it has been very beneficial for them. Some of our moms even have been the speakers of Club Mom based on what they're doing in their work, in their job. They have, for instance, we have one mom who has come out and to speak with us when we do community engaging efforts like the Baraza, which is an annual event that we do with that women make health pledges and CPR and things like that. So it is very engaging, various different topics, and and we look at what we really want to do here is look at the 0 to 5 population. And when we're supporting parents of the 0 to 5 population, we're supporting those children. And we look at it that way. We're doing healthy screenings in there. So we have blood pressure monitors where moms get to do a digital reading, and then they check in with me or another one of our health educator, Nina, and can look at and track how their blood pressure has been over time, so that when they go into their clinic, they can talk about what it is, learning that, you know, they are partners in their care, they're partners in our program.
Yeah. I know your program has only been around for about 18 months, a year and a half or so, but other places it's been going on in Alameda County for a long time. What kind of impacts are people seeing with this kind of program?
Well, really, they're seeing that we are able to do not only individual interventions, but community interventions in bringing community resources to the families, and that improves the quality of care. It's also looking at the COIN initiative. That's something that we're doing, the collaborative improvement and innovation program. So that's something where we have an enhancing the impact of that.
Mm-hmm. Because this is also linked to Healthy Start, which has been around for a long time to really focus on infant mortality. Is that correct?
Yes, it has. In our initial start, Healthy Start did assist us with getting up and going, and they went out to Alameda County to kind of see what they've been doing, and so yeah.
I understand you're also thinking about a Club Dad.
Yes, and you know, that is so exciting because this is something that we have not done before with public health, and we are linking with the UJAMA program in St. Paul, who have been known to have services for African American men for a long time, and we're very, very excited about that. It's we're in the process of figuring that out, and right now.
Good.
Yeah.
Well, Tamiko, this sounds like an exciting program. I'm going to have you come back after you've had another couple of years under your belt and see the kind of impact you're having. So thanks for being with us.
Thank you so much.
All right. And I'll be back to continue my conversation with Commissioner Carter right after this message.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
Welcome back. We're talking about public health and health and all policies in Ramsey County with Commissioner Toni Carter from Ramsey County Board. Commissioner Carter, in the past you talked about community, and Tamiko was here talking about input. How do you as a county commissioner get input from the community? How do you get the community engaged and take ownership of some of the issues in their community? Because as I mentioned in my introduction, the community is so important to enhancing health, and Tamiko really reinforced that, is that the community is important in holding people up. How do you get input? How do you engage the community? How do you empower community to take some leadership in this?
Well, thank you. I'm so glad that we had Tamiko Ralston here today. She's one of our hero public health nurses, one among many really, who go out and who engage in our community in ways such as the Club Mom, which is gathering together young women, and then Club Dad, which will be gathering young men together. But again, we have a history of collaboration in Ramsey County, and that's good public health. Going out, of engaging with people, whether it be in public housing or in other organizations, going to their tables, really getting to their space and understanding what makes you healthy, what keeps you from being healthy. We just got done putting together our community health improvement plan, where we gathered together, I think, over 80 people over a long period of time to look at what does Ramsey County need to do in order to address those issues and to help our community, individuals, families, community organizations, engage in healthier behavior and accomplish greater outcomes, whether it be what we're doing or whether it be the environment. What kinds of impacts and changes do we need? We have an active living community which engages people from cities throughout Ramsey County, and looking also at, are we doing the right physical activities to keep us healthy? Do we have the right environment to encourage those activities? Are there sidewalks? Is the lighting appropriate? Is our built community appropriate to help us engage? Are the streets designed properly so that we can be active, whether it's biking or walking or hiking in some areas of Ramsey County? We are looking together, not simply as a county, the staff within our area, but together with people from our cities and people from our neighborhoods at what we need to do to be healthy. And again, their input goes into our community health improvement plan. That plan is then executed in Ramsey County. And our community health improvement plan also is a very important part of our economic prosperity initiative, which I mentioned. So much of the input for our health and all policies across everything that we do has come from what we've received through that community health improvement process.
Right. I love to hear you keep saying the economic improvement, because we know that income, adequate income, is so important to health. The other thing that I really look as the state health commissioner, I'm looking across the state and making sure that we try to get as many people as healthy as possible and reduce disparities. And we're becoming an increasingly diverse state. And we have some disparities throughout the state, particularly among people of color and American Indians. But, and certainly the counties of Ramsey and Hennepin have really seen this happen, the increasing diversity, before the rest of the state has really embraced it. So what are you learning about disparities, particularly in Ramsey County, and how you're addressing them that really could be a model for the rest of the state? Because if we don't deal with the disparities, we're not going to be a healthy state.
Well, I think that's what we're learning, absolutely. Ramsey County looks so much more like an urban city these days. We probably more closely reflect the population makeup of a Minneapolis rather than, or as opposed to other counties, which are far less diverse. But we are today where other counties are going to be, and they are quickly seeing their populations change as well, and needing to address the disparities which will keep us from advancing. We want to all be prosperous communities. And as we look at our county with the growing and changing population that we have, we will not be if we are not able to address the disparities that keep people of color and low-income people from being housed well, from having good jobs, being employed in living wage positions where they can take care of their families, and which lead to the education disparities. This is not a singular factor. Education is impacted by economic poverty. Housing is impacted. All of these areas of our lives are. And if we cannot, through a health and all policies lens, address those disparities, then we do not have the prosperous future that we have seen here in Minnesota. We want to protect our standard of life. And only by making sure that all are well can we make sure that all are well.
So how can county commissioners, particularly in Ramsey County, how can you sort of influence the education policy, the housing policy, the transportation policy to say, you have to look at equity, you have to look at reducing disparities as part of it? Are there ways that you're trying to do that?
Well, although we don't like to admit it, we're involved in education. We see young people from some of the various earliest points in their lives, let's say from before they're born, as we're working with their mothers through our MFIP, or Temporary Assistance for Needy Families. In Minnesota, we call it the Minnesota Investment Program. We're seeing those families early on. So some of their first learnings, we're exposed to it. As we look at those children through our economic prosperity lens, we now know that we need to address outcomes for those children, very early on to ensure that they're prepared for school. We've always been able to work to identify early on the kinds of issues, hearing or sight or other things that might keep children from doing well. Mental health issues. We see these children early. We see them in our system later on. So we are connected to those things that help people to do well, whether it be the ability to have good food in the home, or if it's the ability to have issues addressed early on that may impact learning later, we're able to do that. But we also have to connect with our schools. We have to be a part with our schools and our cities of addressing holistically the issues that impact children. In St. Paul, in my neighborhood, for example, we have a Promise neighborhood, which brings our public health people together, our employment people, and others together with our city and with our schools to say, how can we holistically help children and families do well so that they will prosper, so that they can be well educated.
In the last 30 seconds, you've been the head of the Association of Minnesota Counties, and I know you're engaged nationally with the National Association of Counties. What's the one message you want to give to other county commissioners related to improving the health of their communities?
You know, I'm not an expert in this. None of us are. But we all want to be healthy. We want our children. We want our families to be healthy. We want to live in a community that we want to live in. All county commissioners have to be involved in the comprehensive issues that affect the health of people through every window and every area of work that we do. And we've mentioned those already.
Commissioner Carter, this has been wonderful. Thank you. I feel very optimistic about the direction we're going with your leadership.
I feel very optimistic about the direction of our state with yours.
Good.
Thank you.
And I'll be back with a closing comment right after this message.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed all that.
Today, women can do anything men can do. And there's one thing we're even better at.
I go around the state pitching horseshoes with whoever wants to join me on the horseshoe pitch. I use this opportunity to pitch public health ideas to local community members and have them pitch me ideas about how the state health department can help them create a better community. What I've discovered in these Pitch the Commissioner events is that some of the greatest public health advocates are county commissioners. Being from the community, they know the issues that are important to their community. They know what works and what doesn't. And as elected commissioners, they also have the power to actually create and implement policies that improve the health of the people in their counties. County commissioners are unique in that they can actually take a health and all policies approach in addressing the social determinants of health. Because they have responsibility for economic development, transportation, housing, environmental quality, health and human services, corrections, and often education, they are uniquely positioned to set policies that impact health and determine how to invest public health resources to improve the health of their communities for both the short and long term. They are also accountable to the public, which helps assure community engagement, which is so important to public health. County commissioners are some of my best public health allies, so pitch them some ideas so they can pitch them to me the next time at a meeting with them, or even better, at a horseshoe pitch in your community. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.